portfolio company isn't reducing hospital readmission, then it's not just missing out impact, it is bleeding ROI. Here's how you can figure out what's the difference between a business plan that works on a pitch deck and the real solution that truly can create change within an enterprise system that is helping all of us in healthcare to move forward and reducing the burden that we carry every day.
Welcome to Provider's Edge, the podcast that helps healthcare entrepreneurs and innovators break down barriers and control their business, life, and future with valuable action steps. With me, your host, Sabrina Runbeck, a recovered clinician and a business deal catalyst. Let's rewrite the rules and create a positive social impact while increasing your profitability. Welcome to another episode of Provider's Edge. Today we have the amazing Dr. Colin Banas here from DrFirst. And we can't wait to have this conversation into how do we leverage internal medicine and primary health into a better spot. And whether it's you thinking, hey, technology nowadays has been endless solutions, but how do we actually bring it to the point that is helpful for clinicians, for the patients and caregivers all together? So love for you to give us a little quick introduction of yourself. What brought you to the space to creating DrFirst?
Oh, well, that's very kind. So, as you mentioned, Colin Banas, I'm an internal medicine physician and the chief medical officer for DrFirst. But prior to that, I was the chief medical information officer for a large academic health system in the Mid-Atlantic. So in terms of bringing technology to bear on patient care and outcomes, it's kind of been in my blood for over 20 years now. And so I was at an academic health system for close to 20 years, and then over 5 years ago joined DrFirst to really help drive innovation and strategy for this company that has a laser focus on medication management. So my background is, of course, in internal medicine, but also in patient safety and medication safety. And so this seemed like a perfect fit for a lot of the things that I had been trained on during my time in healthcare.
Yeah, for sure. From a clinician perspective, my subspecialty had to be in CT surgery for many years, and people come to us, it's a huge list of things for us to admit them, discharge, all the things we have to change, and then to recommend, hey, please go back to your primary care so they know what is happening, right? Close the loop. But sometimes the gap is still there, whether somehow they didn't make an appointment or when they got discharged, things didn't get covered, right?
Yeah.
And that's when you start seeing people get readmitted, and there's all different type of complication. Then as a program, then we're going to get dinged for things that's not happening. So then it's not so much on who's at fault, but simply how can we do a better streamlined system to put the right pieces together?
Yeah, we called that voltage drop. So anytime there is a handoff, whether it's inside the hospital, ER to the floor to the ICU back to step, any of those things, there's the opportunity for something to be missed. And we would always call that a voltage drop. And there really is a nice role for technology in filling that void and making sure that the voltage stays where it needs to, but it doesn't always happen. And, as you know, this is how people get hurt. And you're right, it all comes back full circle when the patient shows back up in the ER and gets readmitted. And so there really is an opportunity, I would say, in interoperability in terms of making sure that we can close these loops between providers. And then inside of that interoperability, there is a role for technology. And the technology is getting better and better.
One of the most overlooked risks in patient care is not a misdiagnosis. It's what Dr. Colin Banas calls a voltage drop. Those moments when care transitions, like hospital discharge to primary care follow-ups, get disrupted, creating costly and dangerous gap In my conversation with Dr. Banas, we walked through how DrFirst is solving that with an end-to-end medication adherence journey that doesn't just integrate with over 270 EHRs. It actually fits in the way clinicians and patients already work. The result? Fewer readmissions, better engagement, and an experience both provider and the patient can feel good about. If you are a founder with an established solution and a growing user base, you are ready to be seen by investors and healthcare system decision makers, then we would love for you to apply to be a contestant on HealthTech Showdown. Go to healthtechshowdown.com to apply. Every month, we award one qualified company with an $800 scholarship toward this media opportunity, plus $5,000 media press gift for the winner. Think you should be in the spotlight? Apply to be a contestant and send us a message about your solution and why you want to present in front of investors, backing companies in your niche, and the decision makers already searching for solutions like yours.
Each subsequent year.
We've seen that transition of accepting technologies here to help us instead of, all this AI big talk.
Yep.
Right? And then people get scared of, what if AI is going to take over our job? You still need a human element in it to make sure the information that you fed into the AI is correct. And then when it comes back, it's not fabricating information.
Yeah, hallucinations,
Right, hallucinations. And we've seen a lot of ICU patient hallucination, right? We needed to also make sure the entity, the system that's got set up, help us at least get to 80-90% of what we need to be and not have the refinement for people. And then we know ultimately at the end of the day, leaders are never able to be replaced. So how can we leading the change as you stepping into DrFirst? So thinking about all these possible solutions into that interoperability, medication, compliance, right, streamlining, what do you see as competitiveness in you guys at this current stage?
Yeah, one of the unique things about DrFirst is that we actually have solutions that are what I would call the end-to-end medication management journey. So if you think about from the time the patient shows up and has intake, and some medication reconciliation, all the way from a prescribing decision and making sure that I'm prescribing correctly and safely to making sure that the patient gets it filled. If you follow this little journey, DrFirst actually has solutions all along the way. And because it's all contained, we actually have the ability to influence at a broader scale. Which is really exciting. So it's not just a one-off solution. We can help you with MedRec, but the rest of it, you're on your own. No, we can help you with all of it. And I think that's really exciting. One of the more exciting things that we've had in the past 5 years is around patient engagement. And what we're able to do is at the moment that a prescriber is making that decision and transmitting that script, we can also generate messaging. And this is tailored messaging to the patient via SMS that says, hey, Dr. Banas just wrote you for 3 scripts. Here's what they are. Here's where they went. Here's what you need to know about those scripts. So we're closing the education gap via this app-like experience on SMS. But we're also able to bring them savings opportunities, right? The number one reason for non-adherence is cost. There's this magical inflection point around $100 out of pocket where the compliance just plummets. And so we can bring to bear cost transparency as well as cost savings opportunities directly to the patient. And we're able to show this is real. One of the cool things that I get to do is applied clinical research. When patients engage with our solution, and it is tailored to them, that's where AI comes in, we can often see a 10% bump in adherence just from simply getting them engaged. The script went here, click here to schedule a reminder, click here to save about. And so these are all abilities to bring in all of these disparate points and focus them towards the patient. And that's some of the...
Dr. Banas gave us a real behind-the-scene look at how DrFirst closes the loop on medication adherence, starting from the moment a script is written all the way through patient engagement and refill. What stood out most was how their text message-based system doesn't just nudge patients, it educates them, shows them saving, and helps increase compliance by 10%. That's a huge win in preventing avoidable ER visits and improving outcomes. And let's not forget, when the system fits into the clinician's existing window, everyone benefits. Now we wanted to hear from you. Wherever you're watching, listening to this, what's one simple shift in your patient experience that could move the needle in retention or results? Drop in a review or comments below, or tag someone who's involving in this space. We're here to learn from each other.
Unique stuff that we're working on, DrFirst.
That's really fun. We always believe the best way for adoption and retention is you actually have this very clear customer journey.
Yep.
So people know exactly what they get into, how they do it. And sometimes people are really clear in the beginning of like, oh, this is a benefit. But once they start getting enrolled into the program, then the retention is not there, is because the support system wasn't clear enough. So when you build that step-by-step wise, and as you mentioned, it's end-to-end, then they don't feel like they have to seek additional help somewhere else, then it actually distracts them instead of being more compliant into, okay, this is where I pick up the medication. This is how I'm going to do it. Okay, there's no barriers on payment, right? You guys seem to have already thought about other objections from the patient and solving it into the product services you
Yep.
have. And as you are bringing this amazing solution into the market, what are some of the current goals as you're speaking on our podcast, probably speaking on other areas? How do you making sure to get the right messages in front of people?
So it's two. The overall goal is to get patients on and keep them on appropriate therapy. That's our bread and butter, right? When patients don't take their meds, bad things happen, including all of those things that we opened with. The way that we do that is with data. Like, you can't manage what you can't measure. And so we are dogmatic about how we are measuring these programs, the impact that they have. Not only are we gathering operational metrics, we sent this many messages, this many patients engaged. No, we're actually taking it the next step. And it led to this many people filling their medication. And guess what? When we get to partner with a health system who is using our solutions, and they share the data with us, we can go to the next step and say, and your readmissions went down by an odds ratio of 5%. And so when those things are happening, we know we're on the right track. When they're not happening, it's when we have to pivot. And so it's not always about the shiny new toy, AI. What is the trial and error or the experimentation process where we can iterate, learn quickly, fail fast, fail forward, so that you can get to the correct solution. And so you're always striving for the goal. But the getting them on and keeping them on therapy, and then selfishly, I want to provide what I would consider a joyous experience for the patient and provider in providing medication management care.
Yeah, I think that part is very crucial, the joyous experience. We seen the best solution is not always the most unique. It's actually how sustainable this entire company and this solution can be. And the main three factors, what we measure is, number one is how healthy is that, right? As an entity, right? How you run business, how efficient, how the client journey is, how healthy is that? And then as an individual who work behind the scenes, how do you feel good about the way that you're performing, right?
Mm-hmm.
And because at the end of the day, we're selling health. If we're not healthy, then we are kind of hypocrite in that story.
Yeah.
And number two is, how do you create space? Right? If we don't have space, we're constantly working, we're double down on everything. Then it's like a rubber band, you're making it super tight. Eventually, you're going to rupture. It could snap. So do we have space to even bring in the creativity, be able to adapt into these new ideas? And then third we look at is
the joy part.
Yep.
How much fun do we actually have? Without fun, motivation got killed, despite how much you say you're on mission, your core value is there. So as we go forward, it's about getting people on the same page at the end of the day. So for you guys, it seems like your major marketing channel is targeting health systems, or is there other entities that you guys are focusing on now?
Yeah, it's both. I would say that health systems are attracted to our solutions because they are constantly trying to reduce readmissions, bring down the length of stay, and more importantly, improve outcomes. I think we always forget that. Like, it's all about outcomes. But also on the outpatient side, whether it's a giant outpatient specialty clinic or a small, singular solo practice, our solutions, can provide for both. And so we're focused on the entirety of the provider solution and how that bleeds into the patient solution. Because go back to our mission, getting them on and keeping them on therapy. And so, you start with the provider, but it creates this beautiful closed loop circle.
Okay, awesome. So that means that for everybody who's listening, if you are a healthcare system leader, as well as those ACOs and private practices, and thinking about compliance, especially from the medication, pharma, and then discharge, admission, and closed loop of going back to your own clinic, then check out DrFirst. And as we are coming up with messaging solution, getting more people out there, have you guys considered even going to go through award process, competing, and seeing who else is out there doing similar things as you guys, and then also be able to be the leading forefront of these?
Yeah, it would be foolish not to keep tabs on what else is out there. But we do think that we are on the forefront of the end-to-end medication management journey simply because of the space that we operate in. We're actually integrated into over 270 different EHRs, believe it or not. And not just different EHR types. I didn't even know there were close to 300 EHRs out there. But there are, and we have deep integrations. So back to your earlier comment about making it joyous, the level of integration, the seamlessness of it also plays into that. And so I think that provides an advantage to us versus some of these other one-off solutions, because when we can get you in front of workflows, when we can get you right into that decision-making process without making you jump out, without making you log in somewhere else, then we have an advantage. And so, yes, of course, we're keeping tabs on what else is happening in the industry. I think we're all keeping tabs on AI, generative AI in particular, as it relates. But I do think that we are in a unique position at DrFirst. And that's why 5 years later, I'm still excited every day to go to work.
That's fun. I think that's very crucial in having the right leadership for your startups, for your mission. It's about, are people still having fun? Their excitement is still there. It's still aligned with the purpose of what they see themselves into the change maker of our industry. And it's so crucial to have you in that place to drive the mission for DrFirst. And I definitely, as you guys are keeping tab, love to invite you guys for our game show as well. That is our fun way of putting people on the spot among other who are in the same niche, to see when we understand each other, we do things better together. Okay. And at the same time, there are a panel of experts who are specialized in both the investment side or leader side, to see how do you guys come out on top to get that direct exposure. So more information to come to that. And we are super excited for you guys to have the conversation with us. How can people find you?
Oh, it's easy. DrFirst, DrFirst.com is the easiest way. I'm big on social media, so you can find me on LinkedIn and Twitter, X, whatever we're going to call it these days, Colin_Banas. And I'm happy to interface with anyone who's interested. It's my job. It's my passion.
Amazing. We see solutions are always out there. It matters on what type of problems that you're solving to find the right solution, and the people ultimately is the driver in making the amazing changes that we're all facing together. So As always, let's build the empowered ecosystem we know we can and not feeling like we're restricted by what's out there. So appreciate you for joining us, Dr. Banas, and for everyone who's listening.
Thank you so much.
Most of us don't realize how fragile the care journey is until it breaks. During my time operating in cardiothoracic surgery, I thought the hardest part of saving lives was in the operating room, but I quickly learned it's what happens after discharge that really decides patient outcome. That's what Dr. Banas and I explored in today's episode. And I have to say, it was a conversation that made me rethink the way we define real health tech success. Here are the 7 key takeaways from this episode. Number 1, voltage drop are the silent killers of care. Every time a patient hands off from one touch point to another, ER to floor, hospital to home, there's a risk. Dr. Banas calls this the voltage drop, where essential information slips through. Number 2, real-world integration beats feature fatigue. It's not about having the flashiest feature. DrFirst is embedded in over 270 EHRs, not as a bolt-on, but as a workflow native experience. That seamless access is what drives adoption and loyalty from providers. Number 3, patient behavior changes when you meet them where they are. This company's SMS-based medication engagement sends personalized message at the exact moment the script is filled. It includes reminders, saving, and contacts. Number 4, adherence problems are often financial. We talk a lot about health equity, but here's the raw truth. When a prescription across the $100 mark, compliance plummets. DrFirst uses price transparency and cost reduction tools to make sure patients can actually afford the care they're prescribed. Number 5, data without outcome is just noise. DrFirst doesn't just track how many messages were sent. They measure filled prescriptions and reduced readmission odds. One health system saw a 5% reduction in readmission after pairing with them. Number 6, a choice experience is a strategic advantage. Let's be real, if the tech adds friction, no one uses. Dr. Banas emphasized creating a joyous experience for both providers and patients. Number 7, last but not least, scaling isn't about more features. It's about sustainable system. What stood out most is that DrFirst doesn't chase shiny trends. They measure, pivot when needed, and focus on building an end-to-end solution that works in the real world. Now we would love to hear from you. What's one handoff in your business or product that needs more clarity or support? Drop your comments or post it on LinkedIn and tag me. I would love to hear your take.
Thank you for tuning in to Provider's Edge podcast. We hope you enjoy our latest episode and found the insights and tips helpful. We'd love to hear your feedback on the show and learn what topics you'd like us to cover in the future. So please take a moment to leave us a review on your favorite podcast platform and let us know what you think. Your feedback is essential to help us improve the show and provide you with the content you need to take your healthcare business to the next level. Thank you for your support, and we look forward to hearing from you soon.